Hello, everyone, and welcome to another Wellness Webinar Sunday. I'm Amy Liebman, President of NTM Info and Research, and I will be your host and moderator today. On behalf of all of us at NTMIR, thank you for joining all of us today. Today, we're delighted to welcome back Dr. Devon Smith, who will present on the topic of understanding and managing fatigue. Dr. Smith is a licensed clinical psychologist with more than a decade of experience researching and treating mental health concerns and psychosocial factors unique to chronic illness. She received her bachelor's degree in psychology at Oklahoma State University before completing a clinical psychology PhD program at Washington State University with an emphasis in health psychology. During her training and throughout her career, she has provided health psychology interventions in a variety of settings, including oncology, primary care, internal medicine, cardiology, pulmonology, and infectious disease. She received specialty training in sleep treatment while working at the Georgia Cancer Center for 2 years. In 2018, she was recruited for a faculty position at Augusta University Medical College of Georgia, which involved creating a behavioral sleep medicine clinic. Currently, she is an assistant professor at National Jewish Health in Denver, Colorado, and works within the sleep medicine and NTM fields. During today's webinar, you may ask a question using the question and answer function on Zoom. Click on the Q&A icon on your screen, type your question into the box, and then click send. At the conclusion of the presentation, the moderator will read questions from the queue for Dr. Smith to answer. Today's webinar broadcast is being recorded and will be posted online at a later date. So if you miss the answer to a question that is asked, you will have the opportunity to hear it again. Next month features 2 webinars in our wellness series. Dr. Michelle McDonald from National Jewish Health will be back on Sunday, August 8th to discuss heart-healthy diets. And Dr. Smith will be presenting on managing stress levels on August 22nd. After today's webinar, please head over to ntminfo.org to seek a quick 3-minute survey about our programming plans for the upcoming year. We'd like to hear your thoughts on that. You can also learn more about NTM Info and Research and sign up for our electronic news at ntminfo.org. And you can find us on Instagram, Facebook, Twitter, YouTube, and LinkedIn. And now, Dr. Smith, I'm turning this over to you. Welcome, and thank you for taking the time to be with us today.
Great, of course. Well, I will go ahead and share my screen here. Okay. So Amy, can you let me know, can you see my screen okay?
I can, yes.
Okay, and is it the one without the notes, the prettier version?
Yes, it is.
Perfect, okay. So it's nice to see so many of you on here this morning or afternoon or whatever time it is for you. So you may remember me from last time. I gave a talk on sleep last month. And I may have met some of you before at National Jewish when you came through for an evaluation, and I might meet some of you in the future. But today I'm going to be talking a little bit about fatigue. So overall, what I'm going to be talking about, first, I want to talk a little bit about understanding fatigue. So fatigue gets used pretty broadly, the term fatigue. So it's helpful for us to get an understanding of what exactly fatigue is. Not only what fatigue is, but what causes fatigue, because there's a lot of different causes that can lead to fatigue and how it can impact your life. And so once we have a basic understanding of fatigue, I'll talk a little bit more about how we can manage it. So factors that contribute to fatigue and how we can address those, as well as utilizing what we call energy restoration and conservation. We'll talk more about that. And then the big one here is we're going to talk about pacing for fatigue, also known as activity pacing. Some of you may have heard of this before. Some of you, it might be a new topic, but it's a very helpful skill for managing fatigue. And as Amy mentioned, at any point, if you guys have questions, just enter them in the question and answer box, and I'll go ahead and address them at the end. So first of all, let's talk about what exactly fatigue is. So fatigue, just by definition, is an experience of low energy that is not necessarily relieved by sleep or rest. So that's an important distinction, because a lot of times, and we'll talk more about this, we have a desire to rest when we're fatigued, and it doesn't necessarily restore our energy, particularly with chronic illness. So you may experience fatigue if you're feeling really low energy, you're feeling really run down, really low motivation. You may feel kind of weighed down, like you're dragging a ton of bricks behind you. But if you were to lay down and try to take a nap, you wouldn't necessarily fall asleep. And that's because sleepiness is a separate state. So, sleepiness is actually a drowsiness that results in an inability to stay awake. So, if you've ever been doing that slow blink, where your eyes are kind of closing and you're having to catch yourself, that's sleepiness. You're having to literally keep yourself awake. And this state, sleepiness, is relieved by sleep. So it's reset. Once you sleep, hopefully that sleepiness decreases. If it doesn't, there may be some other things going on. But really, sleepiness identifies this need to sleep, whereas fatigue, you may want to sleep, but you can't necessarily sleep. And so the two can coexist. So it's not that you can't be sleepy and fatigued, but they are two separate states. So just recognizing what is fatigue and what is sleepiness can help you identify what you need to do. Um, if you're sleepy, laying down and sleeping might be a good step. If you're fatigued, that might involve a different set of action. So, some of you may have heard of this before, the spoon theory, but it's a really good explanation for fatigue that occurs in chronic illness. So, when we're talking about the spoon theory, basically what we mean is that imagine you have a certain amount of spoons every day. So it's a visual representation used as a unit to measure or quantify the amount of mental and physical energy a person has available for activities of living and productive tasks throughout a given amount of time, such as a day or a week. So imagine that each activity requires a number of spoons, which can only be replaced as the person recharges through rest or through just kind of taking some downtime. A person who runs out of spoons has no choice but to rest until their spoons are replenished. However, that's not to say that rest is guaranteed to give a person more spoons. So, for many people with chronic illness, sleep does not perform its normative function of restoring energy. So, in this example, imagine that you have 15 spoons that you start out with every day, but each activity you see here takes a different amount of spoons. And so, how would you use your spoons throughout the day, knowing you only have 15 and you can't get any more? So things like getting out of bed, getting dressed, taking a shower, these are things a lot of people take for granted. It doesn't necessarily deplete people's energy, but for chronic illness, it can deplete energy. It can require more of your energy stores. And so this is a good example that explains the difference between people with limited energy reserves and those with seemingly limitless energy reserves. So people with and without chronic illness. So before you were diagnosed with NTM or had any sort of health issues, these sort of things may not have, really been taken into consideration in terms of, how much energy it's going to take. But once you start living with the chronic illness, these are things that you do have to consider, particularly when you know that you need to do some of these other activities that require more energy. Um, so we'll talk about this throughout the day or throughout the hour we have together. So when we're talking about fatigue, there's a lot of different causes. So there's no one cause to fatigue. For for most of the people on this webinar right now, NTM may be a major cause of the fatigue. So there are certainly medical factors that can contribute to low energy, tiredness, fatigue. NTM can be one. There also can be other conditions, so thyroid issues, anemia, diabetes, other conditions that can sap your energy. Certain medications can cause fatigue, particularly some medications that you may be taking for NTM. And then pain. So if you're living with chronic pain or any sort of discomfort like that, it's going to eat away at your energy levels. So these are medical factors that can contribute to fatigue. But that's not the only contributors of fatigue. There's also lifestyle and emotional or stress concerns that can contribute. So, sleep issues. I won't get too much into this because I gave an hour and a half presentation on it last time. You're welcome. I believe it was recorded. You can go back and listen to that. But if you get too much or too little sleep, it can absolutely contribute to fatigue. So maybe you're having difficulty sleeping through the night, and so you're dozing throughout the day. That's going to leave you feeling low energy and fatigued. And actually, too much sleep can also leave you feeling fatigued. So, people who sleep 11, 12 hours a day, that's probably more sleep than you might be needing, and that's going to lead you to feel fatigued. There's a condition called hypersomnia, where you feel sleepy and fatigued throughout the day, regardless of the amount of sleep you get. So, sleep can absolutely impact fatigue levels. Substances can impact fatigue levels. So, things like alcohol, that can make you feel fatigued, but especially if you drink alcohol and then sleep, you're not going to get quality sleep. And so the next day, you're probably going to feel low energy and fatigued. Diet can contribute to fatigue. Um, Also, low activity. And so that's something that we're going to talk about through with the activity pacing. Um, Unfortunately, our desire to rest when we're fatigued can make us feel more fatigued. So it leads into this vicious cycle. Conversely, doing too much can absolutely deplete our energy levels. So sometimes people overdo it, and then it really takes a lengthy period of time to recover because they've really pushed themselves. So we'll talk more about that in a few slides. Um, and then the last group of factors here, emotional concerns and stress, this is a big one. So depression, anxiety, stress levels, these are all things that can contribute to this low energy fatigue. So, grief, that's also something that can contribute burnout, work stress, family stress, relationship stress. All of these factors eat away at your energy reserves. So, how exactly then does fatigue affect your life? So, fatigue affects multiple areas of people's lives, and it affects people differently. So, thinking about how fatigue affects you. So, which symptoms do you experience when you're feeling fatigued? So, for some people, they might experience more of this physical cluster of symptoms. So, when they're feeling fatigued, maybe your body hurts more. Maybe you feel like your pain tolerance is thrown off. You're more uncomfortable. Maybe you have headaches or an upset stomach, or you're tense. You can't really relax. So these are all physical manifestations of fatigue. There's also mental. So maybe trouble concentrating, frustration, difficulty controlling your emotions, or feeling not feeling any emotions. That can be one too, kind of feeling blank, forgetful, decreased motivation. And then all of this can affect our behaviors. So fatigue can absolutely impact how we choose to go about our day. Maybe you cancel plans. Maybe you're short with people, or you're more irritable. Maybe you're just less active in general. You choose to do less that day, spending more time in bed. Maybe you stop doing self care. You stop doing activities that you used to enjoy because you just don't have the energy to do them. So these are all different ways that fatigue can impact your life. And so thinking about how it impacts your life for you specifically can help you to understand your fatigue and then how to manage it. So hopefully that was a quick and dirty overview of what fatigue is. So let's talk a little bit about how we can manage fatigue. And so this is managing fatigue despite chronic illness. So you might not be able to change the fact that you have NTM. You might not be able to change the fact that you have diabetes, or that you have asthma, or that you have, insert whatever chronic condition you want. But what can you change to improve your fatigue levels? Some of these involve the medical factors. So, managing the medical factors that can contribute to fatigue is absolutely important. So, just like I mentioned, you might not be able to change the NTM, you absolutely can manage it. So following through with treatment recommendations is really important, not just for your physical health and your lung health, but also for your fatigue levels. So one of the problems that I see quite often is that when people are feeling better, they follow through with their treatments less. And so that's really common. If you feel good, then why do you need to do these things? It's not as important to you in that moment. However, that then leads you to feel worse over time. So it's really important to keep up with your treatment recommendations, regardless of how you're feeling. So even if you're feeling good, keeping up with those breathing treatments or keeping up with the medication, um, that can absolutely affect your fatigue levels. And I'll talk in a minute, though, maybe the medication is what's really driving the fatigue. And so, what do you do despite the fact that your medication is making your energy low? Um, One of the things that you can do, and I have it down here, is talk with your provider or pharmacist about when to take certain medications. So certain medications, I can't, run through a list of every medication that can cause fatigue, but things like antihistamines, blood pressure medication, certain psychiatric medications, they can leave you feeling tired, fatigued, low energy, sleepy. So talking with your provider or pharmacist about when you should be taking those medications, because I can't tell you the number of times I see people that are taking medications that cause fatigue in the morning, when really it should be taken at night. So that's something that you can talk about. The other thing is interactions. Sometimes, certain medications interact with one another to cause fatigue, to cause these side effects. So a simple change like taking the medications at two different times can improve your fatigue levels. So just making sure with your provider and or your pharmacist that that you don't need any small changes like that can be really impactful for a lot of people. Also, routine blood work. So check your iron levels, check your thyroid, check your sugar levels, check things that might be off once a year or maybe more. Talk with your doctor about just getting some routine blood work if you don't already. Consider a sleep test. If you're having trouble sleeping at night, if you're feeling really sleepy during the day despite sleeping a lot, it might be time to look at your sleep and to see if there's anything that's going on that you can treat, such as sleep apnea. Particularly with lung conditions, there's times when breathing can get off at night. So people can stop breathing or have difficulty breathing, have low oxygen levels. Sometimes just treating that can improve your fatigue levels. A lot of the people that I talk with, they're like, I don't want to sleep in a lab overnight and get this test. Well, nowadays, the test is much less invasive. You can actually do a home sleep study where you just go into a center, you pick up the equipment, you put it on before bed, you wear it overnight, and you bring it back and they score it. So talk with your provider and see if that's something that might be helpful. Your primary care doctor is a good start, but you can also talk to your pulmonologist. You can talk to a sleep doctor. There's, a lot of people that can help see if this is something that might be necessary. And then managing pain levels as best you can. Maybe you have a condition where you can't get rid of your pain levels, but can you do anything to improve it? Because pain absolutely can sap your energy. Um, so making sure that you're treating and managing it as best you can. A lot of times that involves getting ahead of the pain, because once pain sets in, it can be harder to treat versus getting ahead of it. Also making sure emotional well-being is in check. So managing stress levels, promoting emotional well-being. This could be something as small as making sure you're engaging in self-care. Then I'll talk more about that in a few slides. Um, Something we call behavioral activation essentially means doing more when you feel like doing less. So a lot of times when people are depressed or feeling down or just feeling not motivated, they may do less of the things that they used to enjoy because they're not feeling the enjoyment anymore. Well, that's going to make you more depressed and it's going to make you feel worse emotionally, which makes you do less. And it's just this vicious cycle where you go around and around and you're ending up not doing anything that you used to enjoy. So, forcing yourself to do things that you could enjoy or that you used to enjoy, even if it looks a little different. Maybe you can't hike up a mountain, but can you sit outside in the morning with a cup of coffee or sit outside, in the evenings when it's cooling down, something like that, where you can still get some enjoyment. And so you're still engaging in activities that could bring you enjoyment. Your mood will eventually follow. Counseling, maybe considering seeing a counselor or talking to someone just about how to manage and how to cope with all this stress. And also considering medication. If you have some depression or anxiety, the first stop, my recommendation is always to talk to your primary care doctor. You don't have to go straight to a psychiatrist. Maybe that's who you need to talk to eventually. And a psychiatrist is a specialized doctor who prescribes this type of medication, but usually primary care is the first stop. And usually they can handle this type of medication, so you don't have to go to that higher level of specialty care. But at least asking your primary care doctor, because there are some medications for depression that can also help your fatigue levels and your energy levels. So killing two birds with one stone. So just making sure that your stress levels and your emotional well-being is adequately managed, because if they're not, it's going to make your fatigue worse. And then managing lifestyle factors. So this doesn't mean that you have to start some crazy exercise, program, or start cutting out every single carb and sugar in your diet. This is with, in some degree of moderation. So maybe monitoring substance use. So if you drink alcohol, maybe that means having a glass of wine instead of three. Fueling your body with nutritious food. It's amazing, and I'm sure when you have the nutrition talks, you hear more about this. But sometimes fatigue really is masked by poor nutrition. So eating something higher in protein or getting a snack that's higher in protein, something like that when you're feeling fatigued can sometimes help. Staying hydrated. Dehydration absolutely impacts fatigue levels. So making sure that you're hydrated throughout the day, because if you're not, that's not going to help your fatigue. And then, as I talked about before, making sure that you address any sleep issues, because that can contribute to fatigue levels. Okay, so getting into the main part of this that I wanted to talk to you about today, which is managing fatigue through activity. So, as I mentioned before, our natural instinct often is to do less when we're feeling fatigued, which can lower our energy even more. So, instead, what I want to try to talk about and encourage is energy restoration and energy conservation. So, energy restoration, this first technique that I'm talking about here, um, works to restore your energy when you're depleted. And so this is engaging in self-care activities or certain behaviors that can offer you a sense of enjoyment and well-being. So in this little example, it might be hard to read over here, but imagine that you have a cup, okay? And when we're fatigued, when we're stressed, when we're not feeling well, this cup is going to run low. Our water levels are going to be depleted. So prioritizing self-care is tricky when we're stressed or when we're not feeling well. But if we do self-care and if we're consistent with it, we can rebuild this water level or our energy level, whatever you want to call it. And so thinking about self-care like a cup of water, and if it's empty, how can you drink from it? How can you offer a drink to others? You can't. You have to replace that water. And so doing activities like self-care can help with that. And that's a type of energy restoration. So even if you don't feel like doing these activities or you don't think that you're going to enjoy them, pushing through can help restore your energy over time, essentially by refilling this cup. And so you see some examples over here of self-care activity ideas. They don't have to be anything big. It doesn't have to be even a physical activity. It can be something as small as laughing, calling a friend that makes you laugh, watching a video that makes you laugh. um, writing, journaling, reading, sitting outside, stretching. So these can be little activities that can over time promote self-care and well-being. Then the other strategy here is energy conservation. So if we think about energy conservation in terms of sustainable energy, the goal with sustainable energy is to achieve, electricity or power in a less destructive manner for the environment. Same thing with energy conservation for fatigue. So we're trying to achieve power and energy, but in a way that's less destructive to us in the long term. So this can involve a couple of different strategies. One is to prioritize and do the most essential tasks first. So a lot of times we go throughout our day without a real plan in place. And that can lead to fatigue and depleting our energy unnecessarily. So you really want to have a game plan for your day. So you want to think about it maybe the night before or even the morning of. Think about what has to be done that day and what can be put off to another day. What are the most important tasks that you have to get done, and what's okay if it doesn't get done. And then start with those tasks that you have to get done that day. Ask for help, especially for more labor intensive tasks. This is hard. This is a really hard thing to do, especially if you're someone that's used to doing it all yourself. Um, but you have to think about it in terms of, by asking for help and allowing other people to help you, you're going to be able to do more. So maybe you don't clean your whole house yourself, or you don't run those errands that are really just going to drain you for the rest of the day. You have, a family member or friend help you out with that. Well, that's going to give you back some of those spoons, like we talked about in the beginning, for other activities. So delegating when you can and asking for help. Like I mentioned, planning and organizing, this isn't something that comes naturally to everyone. And it doesn't have to be, a super strict plan that you have to follow, at, 8:15, I'll do this, at 8:30, I'll do that. It can be as simple as a list of, absolute must do's and, activities coming up, but just kind of trying to conceptualize and think about what you're going to be doing through the day so you know where you need to use your spoons. So what you need to save your energy for. And then activity pacing. So pacing is a pretty simple concept, but it's harder to do. It's hard to put into place, particularly because it's not something that comes natural for a lot of us. So fatigue from a chronic illness like MTM leads to a dilemma. So people with fatigue know that the more they do, the more likely they are to become tired. So some people choose to do less or to spend a lot of time resting, which makes sense in the short term, but unfortunately, that's not a good strategy for chronic fatigue. So that's a good strategy for acute fatigue, so something that just happens every now and then. But if you're experiencing chronic fatigue, days, weeks, months of fatigue, this strategy isn't going to help you in the long term. It comes with some unintended consequences. Boredom and depression. So you're doing less, you're bored, you're just sitting around, which can make fatigue worse. Decreased fitness. So the less you do, you're going to decompensate physically. And so it's going to take less and less activity to make you feel tired or out of breath. So you can kind of see in this spiral here how one can lead to the other, and it just continues to spiral. So you feel tired, you rest, you lose fitness, you decompensate. Movement is more tiring, so you do even less. So you lose some more fitness, becomes even more tiring. Add in some depression or boredom in there. You're pretty tired. It's just going to keep on going. So we have to consider an alternative strategy to acknowledge the fatigue, but also not to stop living our lives. There is another end of the spectrum, and I've seen lots of people like this. So the other end of the spectrum is where people choose to battle through the fatigue and shortness of breath and any other low energy tiredness, no matter what. They bulldoze through. And so this approach makes sense because you're going to be able to get done what you want to get done, but it's counterproductive. because you're going to deplete all of your energy and you're going to push too hard, basically, and end up suffering. So you can see in this little graph here, we call it a boom bust, because basically you're overexerting and then you have to take time to rest because you're so depleted, you overdid it. So over time, it actually leads to less activity. So if you look at this line here, which is the average over time, basically you're going through spurts. You do a lot of activity, you push yourself, push yourself, push yourself, and then you crash because you've overdone it and you're out of commission for days or hours or weeks or whatever amount of time, but it's longer than what you want to be out of commission for. And then you feel okay again once you rest for that longer period of time, and so you push yourself again, and you can just see this up and down cycle of pushing and then having to rest because you absolutely don't have any energy. And so the goal for pacing is to develop this skill that enables you to consistently carry out activities without causing extra fatigue. So the goal is not to necessarily get rid of your fatigue immediately, but to do these activities despite your fatigue, and over time, maybe even improve your fatigue. So it's really this skill for practicing energy conservation. So a smarter way to do things that takes into account some chronic fatigue levels. So it's this middle ground between over resting and overexertion, where you spend just enough time on an activity without pushing too far and ending up more tired than you were to begin with. And over time, pacing allows you to do more, even though in the short term, it feels like it's it might feel like it's getting in the way and you're doing less. It's going to allow you to do more in the long run. So you can see in this graph here, with pacing, you do a little bit of activity and then you rest, but those rest periods are going to be much shorter. And then you're able to do a little bit more and rest a little bit more. And over time, you're going to be able to do more and rest less because you're giving yourself time to rest and recoup, and you're not overdoing it. You're conserving your energy in a way that makes sense. So how exactly do you do this? So this is one strategy for how to practice activity pacing. It doesn't have to be this scripted, so you don't have to do it to this level, but this gives you a basic idea of how to do it. And if you're someone that really likes to do things a certain way or try, have some detailed instructions, this is perfect for you. So basically what you want to do is you want to make a list of some things maybe that you tend to overdo, or maybe some things that you tend to avoid because it's too fatiguing. And so once you have a list of that, what you want to do is you want to choose one of those activities and measure the length of time that you're able to comfortably do this. You're going to measure this at least 3 separate times on both good days and bad days. So days when you feel better and days when you feel worse. And you're going to take an average of these times and subtract a fifth. So what this looks like, let's say cleaning the kitchen after dinner. This can be doing a chore, running an errand. This can be working. It can be a number of different things, but something that you tend to overdo or something that tends to make you feel fatigued. And you time yourself. So this person cleaning the kitchen after dinner, the first time they timed themselves, it took about 15 minutes to where they felt like they were getting fatigued or they were getting more fatigued. And at this point, you're just measuring baseline, so you can continue to keep going, or you can decide to stop. It's kind of up to you. Maybe the second time it took 10 minutes, and let's say this third time, they were having a bad day, they weren't feeling good physically. It only took 7 minutes till they really started to feel kind of run down. And so averaging it all together, that's 11 minutes, and then minusing a fifth. So that equals about 9 minutes. So what you do from here is that you basically try pacing this activity where you have 9 minutes of activity followed by either 9 minutes or more of rest in that example. So let me go back a second. So let's say that someone's doing this for pacing, cleaning the kitchen, vacuuming, whatever you want it to be. They would do this for 9 minutes, and then regardless of how they feel, you would sit down and you would engage in something that's not mind-numbingly boring. It could be reading, watching TV, whatever, for 9 minutes, 10 minutes, 15 minutes if you feel like you need it. Um, Set that time beforehand though, and then stick to it regardless of how you feel. And then you can go back to working another 9 minutes if you want. So this is essentially allowing you to rest before you become overly fatigued. So you're going to need less recovery time if you build this into your activity, and it's going to prevent this onset of severe fatigue. So taking short, frequent rests are going to allow you to do more over time. So also remembering that rest can include relaxation techniques. It can even include some light activity like stretching, going for a short walk. It really depends on you and what makes you fatigued, but doing something that can take some of your attention is better than just sitting there staring at the wall, because you're probably going to feel frustrated that you're having to rest if you do that. You can play around with the duration, timing, and frequency of your rest. So maybe, you decide that you can do 9 minutes of activity, 9 minutes of rest 3 times, and then that really is all you can do for that period of time. So you really can play around with it and see what works for you. So after you've tried this pacing for a few days, 3, 4 days, maybe a week, review how you're doing. If you say that, I did this for a week and it was way too easy, I could have done more every single time, then maybe it's time to consider revising your plan, adding more time to your activity. So you can slightly increase the time that you're active and reduce your rest time gradually. You can retime yourself if you want to be, if you want to quantify it, and then try that other plan for a few days, giving your body some time to adjust. But keep practicing and revising this plan until it works for you. To start, a recommendation is maybe you just want to try pacing for 2 tasks a day. So 2 things every day that you have to do, that tend to wear you down, and you want to try pacing for those 2 activities. Maybe you just want to try 1 activity. But what you want to do is you want to watch for what we call danger times, or times that people tend to overdo it and exceed their limitations. So danger times often are days when people feel good. So good days, it's going to be hard to make yourself sit down and rest because you don't feel like you need it. But remember, this is a preventative strategy. This is a way to get ahead of feeling overly fatigued when doing something that you enjoy. So it's hard to take a break from something that you're enjoying. So if you go on a longer walk with your family, let's say on a weekend, it's going to be hard to sit down if you're enjoying it and you're wanting to keep going, your family's wanting to keep going, but it's going to allow you to keep going longer if you give yourself some rest periods. When you're feeling rushed, pressured, emotionally upset, these are times when you can be careless and really forget to use your good judgment about what you need to do to take care of yourself. So just watching for these danger times and really trying to use pacing during those times. So some common difficulties with pacing: losing track of time. So it's easy to get wrapped up in an activity and kind of forget to take some breaks. And keep in mind, this can be mental activity as well. It doesn't just have to be physical. Most commonly we see activity pacing for physical activity, and it's probably one of the more helpful ways to use it, but it can also be for mental activities. If you're someone that works on a computer all day or you interact with people all day, that takes a toll, takes a task, takes some energy. And so giving yourself rest periods, forcing yourself to take a 10-minute break every 45 minutes, it's actually going to lead you to be more productive over time. So good pacing means sticking to it. So it could mean putting a clock in front of you, setting an alarm after a certain amount of time. My sister actually got me this. It's a little cube that uh, they sell it on Amazon. You basically set it, you put it down, and then after 10 minutes, this will go off. So this is actually a little pacing cube. So there's different ways of doing this, but it helps to actually keep track of the time and not just count on yourself to keep track of the time. Use a timer, use an alarm. Another common problem, not knowing how long to take a break or what to do. So try to make the most of your break. Change your position, change your posture, do something different that engages you. So if you're walking around for your task that you're trying to pace, so whether it's like cleaning your house, going grocery shopping, um, helping out with grandkids, kids, whatever, that doesn't mean just continue walking, but in a different setting. It might mean sitting down. If you're pacing yourself because for mental activity where you're sitting in front of the computer, that might mean standing up, going for a short walk. So you really want to change what you're doing and try to do something engaging so that you're not just, like I said, sitting there and thinking about the fact that you're not continuing. Uh, Making decisions based on how you feel at the time. This is a big no-no. So essentially, this is what you're trying not to do. You're pacing based on time, not based on feeling. So this is really what can lead to that boom bust that we talked about before, where you're going to overdo it on good days and then suffer the consequences of overdoing it. So regardless of how you feel, you take those rest periods. And so remembering, like I said, pacing is about judging an activity and when to stop based on time, not on fatigue and how you're feeling. And it's going to end up giving you more control, even though it feels like it's taking away some of that control in the moment. It's going to lead you to be able to do more. The baseline should be used on good and bad days. And so a lot of times, like I mentioned, you find it difficult on good days, but you really want to try to stick to it. Using a timer, and then really reconceptualizing how you think about breaks. So just in the US in general, we tend to look at breaks as a sign of weakness or failure. And you really have to work on moving past that train of thought. Your break is going to increase your stamina in the long term and allow you to do more. It's going to let you live your life, and it's not going to worsen your symptoms or your fatigue. It's going to allow you to do more. So just trying to reconsider how you think about that. And so in summary, basically what we want to do is you want to address factors that can make fatigue worse. So some things are going to be outside of your control. You might have fatigue from things that you cannot change in the moment. But looking at those factors that I discussed and thinking about what can you change? Where can you make some changes so that you're not making your fatigue worse by accident? Using energy restoration such as self-care, practicing energy conservation like activity pacing. And remember that fatigue may cause you to do less, which can make you feel worse over time. So the key really is to find this balance where you're not overdoing it and you're not underdoing it. I mentioned this last time, but I'm going to mention it every time. A note about making changes: success doesn't happen overnight, including improving your fatigue. So really looking at making small changes. So you're not going to all of a sudden, address every single factor I listed in those: lifestyle, emotional well-being, activity pacing. It's not going to happen overnight. And if you try to do too much at once, it's going to be overwhelming and it's going to really make you burn out. Instead, break that larger goal down into smaller goals. So where can you start in terms of managing your fatigue? Maybe a good place to start is to talk to your doctor about doing blood work. Maybe that resonated with you. Maybe, monitoring your substance intake, so your alcohol intake. Maybe addressing your nutrition, maybe activity pacing, but choose an area to start to break it down into a smaller goal. So for example, practicing that pacing over the next 2 weeks, and then break that smaller goal down into manageable tasks. So the steps of pacing, and schedule those tasks. So just like we talked about organizing and planning ahead, look at your schedule. When can you practice that pacing, or when can you talk to your doctor about that blood work, or really making it manageable and realistic. And this is going to help you make changes in the long term. All right. So, any questions?
Thank you. Yes, I believe we are going to have some questions.
All right.
So let me just call that up. Okay, let's see what we have. Let's see, on the first one. Okay, first question up, we have your talk briefly discussed some sources of fatigue, and the patient who's asking this question wants to know, is there anything we can do affirmatively to actually avoid fatigue?
So, yes and no. It depends on I think your individual circumstances. If you're on a medication a side effect is causing fatigue, it might not be something that you can completely avoid, but you can absolutely not. You can find ways to not make it worse. Um, Also, that activity pacing I talked about, that technically is supposed to be a preventative measure for fatigue. So it's taking into consideration people that do tend to have some of this chronic fatigue, but it's ways to not make your fatigue worse. So it's kind of working with the fatigue. I'm not sure if that answered the question, but I think it's really about looking at those factors that are within your control and addressing those factors, maybe not to entirely alleviate the fatigue, but to ensure that you're not making it worse by accident.
Okay, and we have a few questions that are related to different things that might play a factor in fatigue. So one of them is dehydration. Somebody's asking, what are the signs that people should look for dehydration, and how much hydration does somebody need daily generally?
That's a good question. I would think nutrition is a great resource for asking that. But I do believe that it varies for men and women. I think it's like 2.5 liters for women and maybe 3.5 for men. But there's been some debate lately about exactly how much water someone needs throughout the day. And for people with NTM, there is an important consideration, such as not drinking fluids right before bed, or things like that. So taking all those things into consideration, I think it's really about making sure that you're consistently drinking some water throughout the day. You're not just surviving on Coke or tea or something like that. And that you're not, if you notice you are feeling fatigued, I do that. I do this with my 6-year-old daughter. Let's try drinking some water. That can be an easy first step, just to make sure that your hydration levels are okay.
And actually, one of the patients noted here that if you have like a white tongue or a fuzzy tongue, that's also that can be a sign of dehydration as well. So that's also a helpful tip.
Yeah. Headaches.
Somebody noted that they by 3 o'clock each day, this patient is basically done in. They've run out of spoons, and she wants to know if you have any suggestions to help deal with that. She's a little frustrated with having to deal with her fatigue, and so she wants to know how
Yeah.
to manage that.
So I think one thing to consider is, if your spoons are gone by 3, is there any adjustment you can make to what you're doing before 3 p.m.? Or is it that just that 3 p.m. time where that seems to be the cutoff period? So, are there things earlier in your day that you could do some pacing with, so that you're taking more rest breaks, even though you're feeling more energized before that 3 p.m. time, so that you're able to continue going on past that 3 o'clock time? And if not, if 3 is just your cut time, then one of the things you can do is to plan your activities around that. So that kind of goes with the organizing and planning. So, making appointments, doing what you need to do that you absolutely have to get done earlier in the day, And then knowing that after 3 is kind of your downtime. And also knowing that 3 p.m. doesn't mean like you sit on the couch and stare at the wall from 3 p.m. until you go to bed. What can you do that you can enjoy that might be less work intensive or less physically demanding, mentally demanding, maybe some of those self-care activities.
Okay, somebody wants to know, is it healthy to use edible cannabis to help with energy, or is it counterproductive?
Oh, that's a tricky one. So I hate this answer. I feel like it's a cop out, but whenever I get this question in my sleep clinic, I usually have to say that we just don't have enough data to conclusively say one way or the other. I mentioned this last time, but unfortunately, we just haven't, as a society, really come very far with our research into cannabis yet. Um, One of the issues is that all NIH funded studies have to use one particular strain of marijuana out of the University of Mississippi. And if you live in a state where marijuana is legalized, you walk into a store and you know that there are way more than one type of marijuana strain. So we really just don't know the long-term effects. But what I do say is if you notice that it does help your energy levels and your doctor is fine with it, it doesn't interfere with any of your treatments, I don't think it's harmful to try it. I just can't conclusively recommend it and say that it's, the way to go. I do know it can decrease energy and motivation for a lot of people. So just keeping that into consideration and using it in moderation.
There's a related question. Somebody, and I think you had addressed this in your sleep webinar last month, but she had asked, this person's in Canada, and so she's asking, do you know if there's any particular strain or type of cannabis oil that's helpful for, rest and sleeping? Do you know anything about dosing amounts and if it should be CBD, THC, or hybrid? Is there any information on that out there?
I honestly don't have that information. I'm not sure what it's like in Canada, if it's just medicinal or if you can go into a dispensary. But, in my experience and what I've heard, people are pretty knowledgeable that work in the industry. So, if I would always say get approval from your doctor, because sometimes even if something's a natural substance, it can interfere with your treatment. So you want to make sure that's not going to happen. But once you have that stamp of approval, maybe talking to someone within the industry to see, which strain, which route you want to go, because they have a wealth of information.
Somebody's asking regarding fatigue and working outside the home. Do you have suggestions about how to open a dialogue with an employer about how to deal with feeling fatigued and the need for periods of rest during the scheduled workday?
This is so tricky because it's something that uh, is absolutely not recognized in our culture, unfortunately. But I think a good starting point is to speak with your HR, whatever avenue that is. Maybe get a note from a doctor. A note from a doctor can go a long way because it's hard for people to deny you things that are medically recommended. They risk lawsuits. So working if not your provider, if your employer is understanding, maybe just having a conversation with them, showing them some of this information from, I can send these slides out, or downloading an article and talking about chronic illness and fatigue, and that it's been recommended that you take some short breaks throughout the day. How can you make that happen? If your employer is less understanding, then maybe starting with HR.
Okay. Somebody's asking about like foods and drinks that have, things in them for energy, like caffeinated coffee or tea during the day. Do you recommend that, or does that lead to a crash?
So I recommend it within moderation. A lot of people, especially when they come to me for sleep issues, um, want to cut out all caffeine. So they're like, "Oh, I've already cut out all the coffee I drink. I don't have any more caffeine." And if that's something that you want to try, great, especially if you're having sleep issues. but usually it's enough to just cut it off by a certain time. So caffeine can stay in your system for a really long time. It has a really long half-life. So typically what I say, depending on exactly when you sleep, but no later than early afternoon. So, after lunch, cut out caffeine if you can. If you're someone that like that 3 p.m. time, that's a hard time for you. If it doesn't interfere with your sleep, what you might want to try is they call it a nappuccino. So you drink a little bit of caffeine, so like a cup of coffee, a glass of tea, and then you rest for 30 minutes, whether it's laying down to take a nap or just kind of shutting down for 30 minutes. And then by the time that 30 minutes is up, the caffeine has kicked in and hopefully given you a little bit of energy to be able to carry on. Of course, that's only going to work until a certain time because you don't want to be drinking caffeine too late because it can interfere with your ability to fall asleep, stay asleep, also the quality of your sleep. Um, so I think caffeine in moderation, used smartly, can be helpful. Just beware of the half-life.
Somebody's asking, is there a link between NTM and achy joints and also tendon problems at the joints? And I know that there's a link between that and some of the medications that are used to treat NTM. I don't know if fatigue also plays a role in any of this.
Absolutely. I think, I can't speak to the medical side of things completely as a psychologist, but I think, Amy, exactly what you said is right. And I think fatigue can contribute to achiness and kind of those body aches as well. So it's kind of, I think, all related. And so I think the goal of doing things like pacing is to be able to keep yourself active in a way that's smart, so that you're addressing, so you're not decompensating physically, but you're not overdoing it.
Um, how can you avoid fatigue when you leave your routine, like go on a vacation or visit with family?
Okay, so that's tricky. I think it's about, so I use this with sleep too, right? So for sleep, a lot of what we do is schedule and we stick to a schedule. But when you go on vacation, your goal isn't to sleep. Your goal is to have fun with your family, see the sights, whatever. Same thing with fatigue, and fatigue management. Your goal isn't to follow this to a T, but to enjoy your time. But looking at your vacation and looking at, kind of having a game plan. When are times that you can build in this rest and when might you have to just push through? And then if you do have to push through, planning some downtime afterwards so that you can reset. And knowing that you have limitations. Everyone has limitations with or without chronic illness. But a lot of times we blow past these limitations and then we pay for it. So really just trying to build in that framework where you can take some rest, you can take some break, talking with your family, saying this is a smarter way for me to do things so that I can do more.
So we have another one, and this patient said there's no need to read it, but I do think maybe get your thoughts on this. During their NTM bouts, they find their fatigue to be very debilitating throughout the day, completely debilitating. And I guess I'd like to know what your thoughts are on perhaps addressing some of that.
I think giving yourself some leeway. So if you know this about yourself, knowing that during flare-ups you're going to be having more fatigue, allowing that, coming to terms with that, accepting it, knowing it's okay, and doing what you can how you can. Knowing that once you start to feel a little bit better as the flare-up goes away, you need to try to return to activity as normal or as normal as possible, because a lot of times people get stuck in a routine where they continue to rest as if, they're in this flare up, but they're not. And so that's going to lead to further decompensation. So allowing yourself some grace, allowing yourself to take some extra downtime if you need it, but then getting back into the swing of things once you start to feel better. Also using that activity pacing, I know I keep coming back to it, but it really is a way to be able to do things regardless of how you feel. So maybe during the flare up, you need to retime yourself because maybe it only takes 5 minutes for you to feel completely run down. but doing 5 minutes of activity and 15 minutes of rest is more than doing no activity at all.
Okay. Somebody is asking about when they lay down to sleep, if they feel like their breathing becomes more shallow, and they find this a little frightening. They have been checked for sleep apnea, and they want to know if you have any thoughts on something like that.
So I do. I'm just trying to think because I have more questions, follow-up questions for this person, but if that continues to be a problem, I would definitely do an overnight oximetry test. If you haven't already, just check your oxygen levels overnight, because even if you don't have sleep apnea, you could have hypoxia, overnight nocturnal hypoxia. All that requires is just wearing some oxygen overnight. But if you kind of round out all your medical explanations and it might just be some shallow breathing, there's a great skill called diaphragmatic breathing. A lot of you have probably heard of this before, but it's a way of training your breathing through your diaphragm versus through your lungs. It's a deeper type of breathing. Doing that while you're laying in bed before you go to sleep can help kind of set you into some of that deeper breathing. There's some guided meditations you can listen to. If you Google diaphragmatic breathing recording, you'll get lots of free resources. But maybe try practicing your breathing and retraining it at night, also during the day, so that it's just a skill that you develop over time. Also, making sure that you've probably heard this before, but sleeping at an elevated position is beneficial for a number of reasons.
That was very helpful. Everybody's saying thank you for that. We don't have any more questions in the queue, so I think we're going to wrap this up, and right on schedule. I'd like to thank everybody for attending today. Please don't forget to go over to NTM Info and take our programming survey so we can hear your thoughts on programming for future years. And don't forget to find us online at ntminfo.org. And thank you, everybody, for joining us today. And we look forward to seeing you next month. Thank you, Dr. Smith. And we look forward to seeing you again next month as well.
Bye, everyone.
Thank you. Bye-bye.